Hi, my name is Apurv Sinha. I work as a consultant trauma and orthopedic surgeon with special interest in shoulder, elbow and hand and wrist surgery. In this video, we are going to discuss carpal tunnel syndrome, its treatment options, including surgery. Carpal tunnel is present in the middle of the wrist. It's a tunnel, as the name suggests, where we have bones on one side and a very strong ligament called the transverse carpal ligament, which forms the roof of this tunnel. This tunnel houses a number of tendons and a nerve called median nerve. These tendons help to move the fingers and thumb, and the nerve supplies sensation to the fingers and also power to the muscles of the thumb. Carpal tunnel syndrome is a condition where there is build-up of pressure within the carpal tunnel, causing compression of the median nerve. This causes a variety of symptoms including burning, tingling and numbness in the fingers, leading up to weakness of the muscles of the hand, including thumb. Carpal tunnel syndrome can be diagnosed by clinical examination, taking a full history, and by doing special tests. Tests which can be done in clinic to diagnose carpal tunnel include a Phalen's test, in which the wrist is bent at 90 degrees and is kept in that position for approximately 30 seconds, and this reproduces the symptoms, which is tingling, burning and numbness, especially in the 3 digits, index, middle and half of the ring finger, and also the thumb. The other test, which is very commonly done, is the Turkin's pressure test, where sustained pressure is maintained over the carpal tunnel with fingers and the thumb, and this is held for approximately 30 seconds again, and if there is reproduction of symptoms, it points towards carpal tunnel syndrome. Sometimes we do nerve conduction study test to confirm the diagnosis of carpal tunnel syndrome or to rule out any other pathology. A nerve conduction test is done by placing electrodes on the arm and on the fingers and then passing a small electric current through them and measuring how long it takes for the electrical signal to travel across the nerve. This tells us how severe the problem is. In a number of cases, it's very difficult to tell what causes carpal tunnel syndrome, but the conditions which are associated with carpal tunnel syndrome are listed here in the slide. The treatment options for carpal tunnel syndrome can be divided into non-operative and operative measures. Non-operative measures are usually good for mild to moderate form of disease. These include things like activity modification, using a splint, and then moving on from there, a trial of steroid injections. If, however, the disease has progressed and there are daily frequent symptoms, severe disease on nerve conduction study test, weakness in the hand, wasting of muscles of the hand, especially noticed as weakness of the thumb muscles and wasting of these thumb muscles, as we can see in this image, permanent numbness and lack of sensation in the hand. If these features are present, then a surgical decompression is warranted. Carpal tunnel decompression surgery is performed as a day case surgery under a local anesthetic or a regional block. In very rare circumstances, we can do it under general anesthetic as well. During the procedure, a local anesthetic injection is given in the region of carpal tunnel. This initially can be stingy and prickly, but once the local anesthetic starts to work, this area goes completely numb. Once the local anesthetic starts working, a small incision is given to the skin as shown in the image, and the transverse carpal ligament, which is the roof of carpal tunnel, is exposed. We can see this clearly in this image. In the procedure, this transverse carpal ligament is completely divided, relieving the pressure on the median nerve. Once this is done, the skin is closed with simple interrupted stitches. After the surgery, it's very important to look after your hand. It's important to keep the dressings clean and dry, and to keep moving the fingers and the thumb fully. This will avoid any stiffness in the fingers. It's also important to keep the arm elevated, especially in the first few days, to avoid any swelling of the hand. After a few days, you are advised to see either your practice nurse or a district nurse to look for any problems with the wound. In 2 weeks' time, the stitches are taken out, and after that, simple tasks can be done with the hand. However, it takes good 4 to 6 weeks to get back to full routine activities, including manual and physical work. All procedures carry a risk, and this slide shows you the common risk which can occur. Most common of these is a risk of bleeding, infection, scar tissue formation in the region, pain along the scar, which is commonly referred to as pillar pain, sensitivity of the scar, some weakness which can be noticed for a short duration after carpal tunnel surgery, a small possibility of recurrence of the problem, and complex regional pain syndrome, which is hand becoming very painful and stiff after surgery. For more information about the procedure and the condition, please visit our website, and you can ask any questions that you have when you see us in clinic. Thank you.